things that we'll discuss in detail. And number 4 is the number of the implants. How many implants do you need in the full arch case? And where do you position these implants in which sites? We'll discuss this also today. Number 5 is, do you need to use multi-unit abundance or no need to use multi-unit abundance? That's number 5. Number 6 is bone reduction versus no bone reduction. And number 7, if you have upper and lower full arch surgery, which one do you start? Okay? I hope everybody's excited. Are you guys excited? I can't hear anybody. Are you excited? Yes? Let's go ahead. I'll start with number 1, which is FP1s versus FP3s. What is an FP1? What is an FP3? Guys, I need you to understand that a lot of people think that doing all-on-X means hybrid restorations. That these restorations that have pink in them. But what I want you to know is not every full arch case is an FP3 case. And in reality, whenever you're doing an all-on-X case, the golden standard is for you to do an FP1 restoration. What does that mean? It means if the patient comes to you with teeth, try to just give them teeth. You don't need to give them in the pink. And again, these are the cases where we believe are the golden standard. So that's number 1. If you have these cases, please start with FP1. For those that don't know what an FP1 is, let me go ahead and explain. An FP1 is when you only have enough space for a normal size crown. So if the patient comes to you, they have very little bone loss, very little tissue loss, these are the cases where you restore them with FP1s. On the other hand, if you have a few cases where you have a little bit of tissue loss, a little bit of bone loss, in these cases we always recommend doing them as FP2s. And FP2s are slightly longer teeth. And then the third option is doing FP3s, which is the classic hybrid restoration that has both white and pink. So again, always know FP1 is the golden standard. Go with FP1s if you can. This was recommendation number 1. Number 2, where do you place your implants? Do they have to be on the same level or can they be on different levels? That's really important too. This is my recommendation. When it comes to these cases, if you're planning FP1 cases, it's actually okay for the implants to be on a slightly different level. On the other hand, if you're planning an FP3 case, we always recommend that you plan your implants on the same level, and I'm going to explain to you exactly